All right, good evening, everybody. I'd like to call to order the October 26, 2022 CMH full board meeting. We'll start with the pledge. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next, we'll have Megan read the mission statement.
Our mission: Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next, I'll take a motion to adopt the agenda.
So moved. Support.
Motion from Wallace, support from, I heard Ryan. Any questions, comments on the agenda? All right, all in favor signify by saying aye. 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 All opposed? Agenda is approved. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak on any item on tonight's agenda, you have 5 minutes. There will be another opportunity at the end of the board meeting to speak on any issue. Anybody for public comment? All right, nobody's jumping, so we will close the hearing of the public. We'll move on to item 5. Take a motion to approve the minutes of the regular meeting of the CMH full board held on Wednesday, September 28th, 2022.
So moved. Support.
Come on. Motion from Megan, support from Antoinette. Questions or comments on the minutes? Seeing and hearing none, all in favor signify by saying aye. 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 All opposed? Minutes are adopted. Next is item 6. I'll take a motion to approve both A and B, approval of the minutes of the CMH Board Program and Budget Committee meeting on Wednesday, October 12th, and the CMH Board Policy and Legislative Committee on Thursday, October 6th.
So move.
Support.
Motion from Nick, support from Lori. Questions, comments on the minutes? Seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Minutes are adopted. Next, we'll move on to item 7. I will take a motion to approve items 7A through G. These were items that were discussed at Program and Budget Committee.
So moved. Support.
Motion from Megan, support from Antoinette. Questions, comments on any of these items? All right, seeing and hearing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next, we'll move on to item 7H. This is a new item. I'll take a motion to approve 2 letters that were recommended by the Policy and Legislative Committee.
So move.
Motion from Nick.
Support.
Support from Dana. Nick, did you want to speak to these quickly?
Just, you received the draft letters in your packet as well as the minutes of the meeting. Just to fill you in quickly, the committee recommended that we send a letter to the Macomb delegation in opposition to House Bill 6355, which is the bill that would allow for hospital personnel to approve hospital admissions if CMH approval isn't determined or disapproval isn't determined within 3 hours. It's our feeling, based on recommendations from Dave and from the conversation of the committee, that that's an unnecessary expense. We do not have a problem with getting the approvals made in a timely fashion, generally within 3 hours. I've heard from some other CMHs that they may have that problem, but we don't have it here in Macomb. Our big problem is that getting people from getting placed out of the emergency room. The problem is the lack of beds, and we would rather the state put their money and effort into that. And then the second letter would go to Governor Whitmer and be copied to Elizabeth Hertel, the Director of the Department of Health and Human Services, the Macomb legislation, and Sarah Hanley, who's the head of the MDHHS budget office. This concept came from Dave and from Richard both, asking that when the determination is made as to actuarially sound Medicaid rates, that they incorporate into those rates the additional rates and pay wages that we've approved because of the COVID crisis, because that's going to be an ongoing problem, and we don't want to have to cut rates and wages suddenly once the state of emergency is eliminated. So I would move the adoption of these two recommended letters.
Thank you, Nick. Any questions, comments on these letters?
Well, I think I did.
Nope. All right. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Next is item 8, receive and file. We have no items there. 9 resolutions, no resolutions right now either. So we'll move on to item 10, the voucher listings. Take a motion to approve the bills, pay the bills. Approve paying the bills. Motion from Lori, support from Mark. Questions, comments on the bills? Seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Bills are paid. Next, we'll move on to the CFO update, and Ken is here.
Good evening. I will go through our monthly financial report as we usually do. This is August numbers. Starting on page 1, we have our eligibles and our revenue chart that kind of track together. As many of you probably saw or know, the public health emergency was extended until mid-January. At this point, that is going to keep our revenue and eligibles high for that time period. Expect that the feds have said they're going to give us 60 days notice. That would bring us in right around November the 12th. So we'll see midterm elections. That's a few days later. We'll see what comes out of that. Unknown at this point whether they're going to extend further or if it is actually going to end on January 12th. So that'll be a key metric and thing for us to track. Like was stated earlier, the actuarially sound rates, making sure that those discussions are being had to make sure that, the DCW increases, those are pretty much baked in right now. I don't know how that can be stripped out and, asking some of those questions. So we'll see where Milliman goes with that after the PHE ends, and they've promised to take another look at rates at that time. Switching gears to page 2, kind of a summary of our balance sheet items. I don't think there's going to be any surprises here. We have a lot of cash and investments on hand due to the unusual amount of revenue we have for the public health emergency. Liabilities are quite high as we continue to wait for the state to settle with us on prior years' lapses. I'm going to skip ahead to page 4. It gives kind of our summary by program here. We have included the CCBHC information. Some caveats here related to that. We're actually waiting. Friday, the state of Michigan is supposed to give us an updated FSR template, which will allow us to see how they want us to reconcile and settle with them on these numbers. So I would say next month, when we're looking at September numbers, we should have, at least we'll have the state template in hand. And this is our best use of the information we have. We still have significant open questions to the state of Michigan as it pertains to CCBHC, particularly calculating mild and moderate eligibles. That information is, we'll have to look at our reporting and try to put our hands on that to flesh out some of these numbers. The numbers do look good at this time, so we hope that it stays as is, and don't expect those to change significantly. At the bottom there, you can see fully funded risk reserve. That's expected again this year. Fully funded savings. Flipping to the next page, page 5, let's just give some information on our CCBHC non-Medicaid. We will have some other grant funds that will offset those non-Medicaid dollars, and we're submitting those now, so I expect an update to that section. And the state GF is presented there as well. Flipping to page 6. Again, this is just our balance sheet. I was looking at, we have in accounts receivable, we do have a negative number there. That's a classification issue on one of our entries that should have been posted to due from other governments. So that's why that's showing like that, but it will not be like that going forward. Sorry, these are double-sided. Page 7. This is just our income statement. Again, I'm not going to dive into any particular detail here. There's nothing terribly significant that would have changed from the prior month as these numbers relate. And if we had something significant, we would certainly reach out and start those discussions early. And then pages 8 and 9 show our budget to actuals for the mental health and SUD funds. Happy to answer questions or take something back for research.
Anybody with questions for Ken? Getting off easy tonight.
I guess so.
All right. Thank you, Ken. Appreciate the
Thanks.
report. Next, we'll move on to Dave with the CEO update.
Good evening, everybody. I attended the fall CMH Association conference in Traverse City. I was joined by Nick and Lori and Selena, so that was very nice. Of course, Ken was there from Raymond as well. Just wanted to, from that meeting, there was good information. Farrah Hanley gave an update. But the high point, I think, was when Senator Debbie Stabenow yesterday morning gave the keynote about the benefits of the CCBHC, the positive outcomes it's showing, and her comment that she would be first in line to push back and fight against any privatization of our system. So that was good news because we are going into lame duck right now, and it's kind of anybody's guess right now. So it's really nice to have her in our corner. Yeah, she got I think two or three standing ovations for her comments. So definitely the high point. On the MyHealthLink side, you all approved us not renewing our agreements. I have been meeting with the health plans. There's possibility now we could continue with Molina and HAP. Molina has about 550, HAP has a smaller number. All in with all 5 ICOs, everybody in the MyHealthLink program was about 1,054 people at the end of September. So we would keep about half the people, a little bit more than half, and work with 2 of the ICOs or health plans going forward. The state is looking to continue that program through January of 2026. So we're thinking it would be beneficial for us to stay involved. We have asked for considerations into the next year, into the contract. One of the biggest issues was the audit survey burden from having 5 health plans review us. We've automatically reduced that by going down to 2. So I'll keep you posted on those conversations. We are working to keep the individuals in that program updated, our providers updated. I have updated the department of the initial decision to not proceed in the program at all. And now that it's possible that we might continue with HAP and Molina, I am meeting with the state on November 4th. So I'll provide an update at that time. The We are working on a board action request for next month. I think I mentioned this to some of you, and then we met with our finance meeting this morning. We will be bringing a request to the board to extend the recruitment incentive and the referral incentive through June of next year for people that would be hired up to that point, and then if they work their 30 days, they could get the hiring incentive. There were some delays with the fiscal intermediaries making the changes related to the rate changes that we put in place for the community living support staff and for the recruitment and retention bonuses, or not, I'm sorry, incentive is the correct word. So this will help along those lines too by extending that for, and we did clarify with finance that we have those funds. So look forward to that for next month. This morning, Tracy and Tony and I took a field trip, went over to the north location and met TJ over there. Really nice. A lot of very positive updates. We will be planning as soon as some of the paint dries over there. You all approved the painting. It's mostly done. There will be some additional items going in over there, but the changes already have been significant. We are making every effort to make sure that accommodates our new model for same-day access. And Farrah Hanley spoke about access to services was how she kicked off her presentation. So that very much is our focus as well, getting the word out, letting people know we're here, and then having all of, making it as easy as possible. On that front as well, I'm happy to report that we've had some significant improvement in the response time at the second level of our phone system. So what was happening is customer service under Chanel were doing a great job. The response times were consistently really good. But then for the second level kind of triage clinical screening part, there was a mental health line and a substance use line. There was some log jams at that point. We met with Christine, Tracy, and I. Christine has a plan, and because of our CCBHC now, the historic focus in community mental health was to screen people into services, and in some parts screening people out of services. We had to make sure you met the mental health code criteria, and that you were in fact Macomb County. It was our responsibility to pay for your services and things like that. So a lot of time and energy went into that type of screening. With our new model and new funding sources, it's more now that we're registering people into our system so we can make different types of staff available to answer those calls, help people get connected. There is a staff shortage out there. It is, it's national. But it's within our provider system and stuff. So there is still difficulty in getting intake appointments within our provider system. I'll be meeting with those providers. They're working on this the same as we are in getting those appointments into our central calendar so that we can easily connect people to the next step in that process. But in the meantime, the same-day access at our north location is up and running. So people will be getting help faster and easier. So that's always good news. With the public health emergency, as Ken was mentioning, that again was a big topic of discussion at the state level. The state has not been taking anybody off of Medicaid. So if you were on Medicaid when the public health emergency started, you're still on it. there will be an impact on our system and on those individuals. So we are going to start working internally too. We've run some reports, but we're going to identify the group of people who are at risk, and then start making plans here locally as best we can too. So when that stops, those people, if at all possible, do have the Medicaid paperwork in the system, and hopefully there will be no gaps in their coverage. Let's see the phones. Henry Ford gave official announcement that they are closing their Mount Clemens Hospital. Barbara Rossman called me personally and explained what was going on and what their plans were. They are building a new facility, bigger facility, but it will not be ready until 2024 sometime. The folks who are there who meet the inpatient criteria, the plan would be to transfer them to Kingswood Hospital. So we'll extend our liaison efforts and things over to Kingswood. We do have some people there who no longer meet medical necessity for that level of care, and they're waiting for a community option. Some of the people actually were approved for a state hospital, but with the changes at the state level, the state is now denying that level of care. So we are scrambling to identify appropriate community options, and we'll be meeting on a very regular basis with the Henry Ford team that they've identified to relocate those individuals, find them someplace appropriate. The end date for Henry Ford is December 9th, so we do not have a lot of time. And we already have, groups of people who are waiting. I did get some positive emails today. This is very much right now on an individual basis that we're able to, identify something appropriate for individuals. But it's a lot of time and effort, a lot of stress on the individuals and their caregivers that cannot be underestimated at all. It's a crisis situation. So we're working very hard on each and every one of those cases, tracking them very closely. I do have to also thank Dr. Serpa. She reached out personally to Dr. Mellows, who's the director of the State Hospital Administration, to work on some of these individuals. So it really is everybody at the table trying to help these people as much as possible. So thank you all around, and I'll continue to provide updates in that area. As far as other reminders, we do have some more good news efforts. Tracy, if you want to give another update on what we're doing tomorrow.
Yes, this is my last sales pitch. So tomorrow at 6 o'clock, we're very excited to have Trunk or Treat. It's at the administration location. All are welcome. Trunk or Treat goes from 6 to about 6:50. At 6:50, we have awards including a costume contest for adults, a costume contest for kids, a Trunk or Treat winner, and then we also have our Smiley Awards for individuals who have performed well over the last year, and also a Site Award who did the best from a survey perspective. After that, at 7 o'clock, give or take a few minutes, we are showing on the big drive-in screen Hocus Pocus 2. I would encourage you, you might not be able to come for the whole thing. Like if you have young kids, you can pop in, pop out. If you do want to do the trunk or treat, you have additional questions, you're welcome to see Stacy. She's been advocating all day today. We have an amazing Starbucks huge basket with glow-in-the-dark coffee mugs. Like we have some cool stuff we're very excited about if you aren't picking up on that. The last thing related to that, we're excited. We've already been collecting some stuff, but remember we're creating care closets at each of the locations just with some minimal supplies. And thanks to Nick for donating. But if you have a used tent, if you a newer tent is only about $15 for the homeless, toothbrush, gift cards, like we've got a few gas gift cards, Burger King gift cards. So anything you can do to help, we would greatly appreciate. And if you have any questions, of course, reach out.
Thank you, Tracy. I do have one more update too. I think at our last meeting we mentioned the 236 transfers, which would allow us to share our general fund, that instead of lapsing it back to the department, we could share it with other community mental health service programs that were in need. We did reach out, and then we learned that if the deficit was due to their CCBHC programs, the 236 transfers were not permitted. So I did just reach out today back to Bob Sheehan at the Community Mental Health Association, asking him to ask all CMHs if anybody was in need. We do not know if the state would permit those transfers still, given that we're this far into the new fiscal year already. But if I hear back from Bob, and if the state would permit it, then we'll bring that detail back to the board for review and approval. Thank you.
Thanks, Dave. Questions, comments for Dave or Tracy? Donna, go ahead.
You said that the hospital is going to build in 2024. Do we know where the location is going to be?
Yes. It's not in Macomb County. It's Madison Heights, I believe. And it'll be a 150-plus bed facility, which we'll be able to access and utilize, but it's one less hospital in Macomb County. I also do plan on touring the Mount Clemens site with Henry Ford to see if there's any possible alternative uses for that facility, because our need is so great. Be nice to have the location, but of course then you need staff who are trained and credentialed and able to provide those services. But we are truly scrambling and considering all options right now and trying to communicate that to the folks at the state of Michigan as well. Oh, and I'm sorry, one more update too. The community, well, I'll leave that one for later on when I have some more details, but I'll end there. Thank you.
Thanks, Dave. Anyone else? Questions, comments for Dave? All right. Seeing none, we'll move on to other possible agenda items. I will echo Tracy's reminder. Tomorrow night, second annual Fall Festival at the Admin Building. The November program and budget meeting will be November 9th, Wednesday at 6 p.m. And the full board will be moved to Tuesday, November 22nd, because we're already almost to Thanksgiving. With that, is there any other board members that had any other items to bring up, discuss? Okay, we'll move on to the last hearing of the public. Anybody from the public wishing to address this body? You have 5 minutes. Come on up to the podium.
Hello. My husband's not here yet. I'm Debbie Mack. I'm speaking on behalf of my husband, Joe Mack, and myself. Tracy and TJ have told us we're the largest landlord for special need group homes in Macomb County, leasing homes to the county since 1995. Joe runs the day-to-day operations. From the onset, we have taken a special interest in providing quality living environment for the clients. I had a family member who lived in group homes, so I understand the importance, which is what got Joe interested in it in the beginning. And we pride ourselves on living up to our promises, our commitments, and our integrity is to us the most important thing to us. Unfortunately, right now, we don't feel like the same is being reciprocated to us. It's not uncommon to receive no responses to emails, and there seems to be a lack of follow-through, which brings us here tonight. It makes for a very tenuous working relationship. I know my husband can be difficult to work with, but when you don't have communication, it's very difficult. So during most of the last 27 years, he's had a good relationship with most of the other people who have been in charge. Currently, the majority of our leases are expired. While COVID may have added to the delay, it's not the sole reason. Leases have been expired since 2017. TJ, Tracy, and I and Joe met to discuss the lease renewals in July. And we also talked about the status of the inspection repairs. Dave, at that meeting, we also saw you in the hallway and said hi. During the meeting, TJ and Tracy indicated, even though there's sometimes a tenuous relationship between Joe and TJ, that Joe is one of the better landlords, being very responsive and taking care of the problems that exist in the group home so that the client's needs are met. We had what we believed to be a productive meeting. TJ and Tracy joked I should always come along because the meeting was very productive. And we left with what we thought was a handshake agreement. I summarized the meeting in an email that I sent on 7/27. We did not receive a response, so we sent it again. On 8/3, TJ confirmed he received the summarization. These were the key elements. We are going to make repairs, all of which have been completed. We are to submit confirmation of insurance and taxes, and to get that reconciled with Kendra Militello. That was all done by 8/4. TJ and Tracy agreed to review quotes submitted by caregivers for repairs, finalize some grant funding for 5 of the homes, and we agreed to pay anything that fell above those. We have not heard one thing back on that. With the grants, we agreed we would proceed with 0 rent increases, despite having heard other landlords were receiving increases. TJ and Tracy were to review with Dave 36 versus 24-month leases. We have not heard back from that. Lease renewals were projected to be done by October 1st. We have not heard back on that. About noon on August 5th, TJ indicated to get the leases renewed, he needed us to confirm base rents. 2 hours later, I sent an email saying, assuming the agreement we sent you, that you acknowledged receiving on the 3rd, was approved, there was no rent increase. Base rents would remain the same. We did not receive any updates or response since that email, August 5th. If the agreement wasn't summarized correctly, why not give us some feedback? In an effort to address these concerns, 2 weeks ago, Joe left a message for Dave. Tracy left Joe a message indicating she was returning the call for Dave. Joe did not want to talk to Tracy because he felt like she was part of that meeting. We still haven't heard anything. Nothing personal. So we determined the best course of action was to bring our concerns here tonight. Last week, we did receive an email, but it wasn't about lease renewals. It was a 60-day notice to vacate one of our properties. 27 years we've worked for the county. You just indicated Barb from Henry Ford called you to tell you that the property was closing. It would have been nice to get a phone call before you get a cold email. We got no response to our other emails about the leases yet. This week, we received 1 rent payment for November. Per Kendra, the payments on the other homes were not approved. She believes the balance will be paid in the next check, but we're not sure why the November rents weren't approved. We've never had this occur in the past, so is there something else going on here? That's what we're trying to figure out. The base rent on our Jefferson home is $100 less than it was in 1995. Okay, so we've been fair. We've treated the county with integrity. When we spoke to other landlords, we've told they've gotten increases. During our July meeting, we were told landlords receive increases because they have mortgages, hence higher costs. So, does the county penalize people who run a good business, a stable business? We don't take all the money out of our houses.
You have 30 seconds, Mrs. Mack.
Okay, I'm sorry. All right. At this point, we're trying to identify what is the county's position. Are you renewing leases or are you not renewing leases? We need to make business decisions here too. Otherwise, we're going to have to sell the houses or do something else with the houses. So that's what we're saying. Please, give us an update. Give us a courtesy email. We've been a fair provider for 27 years. That's what I'm asking for.
Thank you, Mrs. Mack. We can't respond to you, but we did hear you. Somebody will get back to you, okay?
Is there a timeline I can expect a response from? Because we always respond very timely to the concerns that are brought forth to us.
Sure. We have staff here, and Dave's sitting right here listening, so we will get back to you.
Thank
you, Mrs. Mack. Anyone else from the public wish to speak? Okay. Seeing none, we will close the hearing of the public, and I will take a motion to adjourn. Motion from Megan, support from Antoinette. All in favor? Aye. All opposed? We are adjourned. Thank you, everyone.